What's up, y'all? What if I told you 1 in 5 people are depressed? Would you believe me? I'm gonna show you some stuff that will at least make you want to research it and wonder what you're looking at when you go outside. All right. So, me having free time, I guess you could call it, when I'm not doing anything. Uh, I was reading some information online that caused me to do some research to see how many people are affected by mental illness, because a lot of people toss around like that they OCD and they anxious and uh, you know ADHD. Um, you hear people throw a lot of stuff around. So I had about 20 minutes of nothing to do, and I looked into just seeing how many people are actually depressed in America, and 20 minutes turned into a whole day. So I'm gonna show y'all what I found, man. So now keep in mind anxiety, right? Because a lot of people say that they anxious. Anxiety is an emotion characterized by an unpleasant state of inner turmoil and includes feelings of dread over anticipated events. Anxiety is different from fear in that fear is defined as the emotional response to a present threat, whereas anxiety is the anticipation of a future one. So if you're anxious, you worried about something that's not real, basically. But anyway, this is not to ridicule anything that anyone is dealing with, because if you dealing with it and you believe it's real, then it's real, right? So um, I was looking at this and found that 20% of all Americans had a mental illness in 2024, but 22% of people older than 18 use antidepressants. So at least I guess they medicate, right? Um, but when you look and see that only 43% of adults with mental illness in 2024 got treated, then that means nearly half of all children, um, well, not that that doesn't mean that, but also I should say half of all children have been diagnosed with a mental illness, which is screaming beyond alarming. Um, the cost of treatment is a top barrier for Americans seeking treatment, is what this is indicating. So, um, not everyone can afford treatment. So, when we focus on the 43% that do get treatment or that have gotten treatment, it's indicating that when they are taking what is considered to be the most popular substances or the popular medications to help them with their depression, it takes about 60 days for the substance to work. But it's indicated that there's an elevated chance of suicide within the first 30 days of treatment. So this puts the patient in a scenario where they are putting a lot of belief in these doctors or these drugs. So what I did was I started looking into what these people deal with when they take these drugs for hopefully 60 days. Hopefully they can get beyond the 30 days. Um, I was a little fearful to start looking into suicide. So I didn't think I was gonna stop looking into that if I start digging too deep because I didn't plan to spend as much time on what I was on. But um, of the most popular substances, it's 10. Makes up 93% of what these individuals are taking. These are our friends, our family members, our co-workers, people in the community. Uh, Again, 1 in 5 people. So if you know 20 people, just random. If you know 20 people, 5 of them, because in at least 5, because with everything medical is underdiagnosed because not enough people go to the doctor. But the common side effects for these people when they start taking these medications, if we think about what these things are, okay, you got diarrhea, abdominal pain, fatigue, indigestion, weight gain, headaches, dizziness, nausea, tremors, muscle twitching, dry mouthiness, sweating, irritability, low sex drive, restlessness, insomnia, serotonin syndrome. Now, this will make me believe that it's gonna get worse before it get better, especially if you tell these people before they take this that these are the things that they could potentially be dealing with. Especially if we start with diarrhea, which if you didn't have diarrhea, for you to get over your depression, you have to deal with diarrhea or abdominal pain, which I imagine would make you tired. If especially if you between that or you don't want to eat or you can't eat. Like I say, man, it's just a lot of stuff, right? It's just a lot right here. But then I start looking into like, okay, it's a lot of symptoms. So like, if somebody in a bad mood, maybe they get by these. Like, let's see what what these do. Like, how can they help? Like, so it when I research each drug, it's like all of them, they all do the same thing basically. They all are general to, like, they all just deal with depression. They all types of depression. So I mean, we understand that there are different types of depression, but all of these drugs, they are general to all types of depression. So what's unique are the side effects because once I started looking into these drugs to see, um, you know, what what does, and I don't want, probably gonna say some of these things wrong. Serotylene hydrochloride, right? Like what does it do, right? So it releases it helps with serotonin, give you more serotonin. So all of these do is give you more serotonin, which is a chemical that make you feel good, give you a better mood. But these give you serotonin syndrome, which too much of that could kill you, and it is not like you can have a mild case, which would be high blood pressure or fast heart rate, which you don't get a fever or any other like noticeable signs that you got serotonin syndrome. So so let's say like you don't get any of these crazy side effects up here, and the drug is working good, it could be killing you at the same time because you could be getting serotonin syndrome because it's working too good and you got too much serotonin. This is a nightmare um, to think about for these people. So when you look into these drugs, or at least when I did, what I found was what's unique are the side effects because this sertraline hydrochloride what's unique about this, other than it's supposed to help with depression or give you more serotonin, it can confuse you. It can increase your sweating. Um, you get uncontrolled muscle spasms, severe restlessness, psychomotor agitation, hypertonia, seizures, irregular heartbeat, changes in vision, hallucination, abnormal bleeding, sexual dysfunction, aggressive behavior, appetite loss. I mean, man, it's just a laundry list of side effects. And if if y'all watch TV, which I imagine most of y'all watch a lot of, or more than what you probably want to admit, like it'd be commercials on there talking about drugs, not probably not these, right? But they're always talking about stuff, these unnatural things that they make to try to cure um, health issues that we have. And the commercials spend more time talking about the like what the thing gonna do to you than what it's gonna do for you. Most of the commercial is telling you what to warn yourself for than what it's supposed to fix. You know, Jesus, this is, I'm reading this one uh, when I got to the symptom that frustrated me the most, which is antidepressant discontinuation syndrome, um, also called antidepressant withdrawal syndrome, um, which is a condition that can occur following the interruption, reduction, or discontinuation of antidepressant medication following its continuous use of at least a month. Side effects sometimes exacerbate or masquerade as a residual depressive symptoms and often precipitate premature discontinuation or the use of subtherapeutic. Um, I copied and pasted that, but I was reading it and I couldn't take no more. I didn't even need any more. Beyond that, I read the name of it, of the syndrome, and just to pique my curiosity or to appease my curiosity, I went ahead and looked up the definition. But it kind of hurt my feelings because I thought it was a drug addict. But then I looked up what, substance abuser was, and it says a person who is addicted to an illegal substance. Um, so when you undress this, and this this is, in my opinion, my personal opinion, this is what's wrong with society, and it's causing a lot of depression within people. This particular concept right here. Okay. Antidepressant discontinuation syndrome compared to substance abuse or substance abuse. I don't understand how one is experiencing or going through antidepressant withdrawal syndrome and they're not a substance abuser, because that would be an interruption or reduction or discontinuation in what would be at that point an illegal substance if the doctor who has prescribed it has said the patient can no longer have it. Now, I understand that we live in a time where we don't want to say certain words and we don't want to call things um, by certain names. We don't want to use certain adjectives. Um, but to say someone is experiencing or is dealing with antidepressant discontinuation syndrome or antidepressant withdrawal syndrome. And I'm pretty sure they probably got acronyms for it because it's a really long thing to say. So they probably got ADS and AWS. What that does is it complicates communication. That's really all it does. Is it complicates communication because explain that to a 4-year-old. Explain antidepressant discontinuation syndrome to a 4-year-old compared to substance abuse. Explain. I think you can you can explain substance abuse to a 4-year-old in probably 5 minutes or less. It might take 5 minutes alone to help them understand, to get them to hear all of what you're saying when you say antidepressant discontinuation syndrome.